Did you know that chronic otitis media is one of the very common disease of the middle ear cavity? It affects almost 10 million people per year in our country. It is one of the major cause of hearing loss in our country. And more interestingly, it is a curable disease. Hi, myself Dr. Anupal Deka. I am working as a principal consultant at Max Super Specialty Hospital, Dehradun. Today I am going to answer some questions of chronic otitis media.
Hello doctor, I am Sanjay from Uttar Pradesh. What is Otits Media?
Hi Sanjay. Otitis media is a middle ear infection and it can be acute, it can be chronic. If the infection persists more than 6 months time, it is called chronic otitis media. Acute otitis media patients usually presents with fever and ear pain, and sometimes there may be discharge from the ear. And discharge can be sometimes blood mix. It is usually yellowish color and mucopurulent. But in chronic otitis media, there can be two types of chronic otitis media. One is called safe type and other one is called unsafe type. In safe type of chronic otitis media, there is profuse ear discharge on and off, and the discharge can be mucopurulent, yellowish color, and usually it is non-foul smelling. But in case of unsafe chronic otitis media, where there is especially infection of bone is also involved in this type of otitis media. So in that case, the discharge is more scanty and it is usually foul smelling and sometimes can be mixed with blood. So we have to find out which type of otitis media it is, and that is only possible after consultation with the doctor.
Hi doctor, I am Vijay from Madhya Pradesh. Can Otits Media lead to hearing loss?
Hi Vijay. It's a very important question. Definitely, otitis media can lead to hearing loss, and this hearing loss can be in the form of conductive hearing loss or in the form of sensorineural hearing loss. Conductive means that means there is hearing loss when there is perforation of the middle ear cavity and due to presence of discharge. And in sensorineural hearing loss usually happens in cases of chronic otitis media, and where there is specifically it involves the inner ear organs, especially the called cochlea, organ of Corti, when it is involved. So there is sensorineural hearing loss in that case. And conductive hearing loss is very interestingly, it can be curable, it is reversible. And if it becomes sensorineural, then it becomes irreversible hearing loss.
Hi doctor, who all are at the risk of otitis media?
The most commonly affected population are the children under the age of 2 years. There are some specific reasons why these children are specifically get more commonly infected. One is the cause, basically they are immunologically more prone, first of all. Secondly, this is because of there's a tube called eustachian tube which connects the posterior aspect of the nasal cavity, we call it nasopharynx, to the middle ear cavity. So in children under the age of 2 years, this tube is more horizontal in positions, which leads to frequent infection from the nasal cavity to the middle ear cavity. So this is one of the most common reason why the children under the age of 2 years are affected. And another cause is that there is because of recurrent upper respiratory tract infections in children because of poor immunity. So that is another cause. And thirdly, I want to emphasize on there is a condition called adenoid hypertrophy. This is a gland of lymphoid tissue which is situated in the posterior part of the nasal cavity, the space called nasopharynx. When this gland usually is enlarged in size in children, and because of that, there is a normal functioning of the eustachian tube is hampered by this hypertrophy of the adenoid glands. So these are the few causes. This particular age group is more commonly affected by otitis media.
Hi doctor, how can otitis media be avoided?
Yes, avoidance of this particular kind of disease is basically awareness in populations, especially in case of in parents of the childrens. So whenever they complain of any pain in the ear or they have unexplained fever, they should immediately consult with their doctors to so that before it goes to the age of to the stage of separation and leading to ear discharge or causing any hearing loss. So it is basically awareness of the parents which can lead to prevention of such kind of diseases. And also in India, in our country, this is very common because of the overcrowding, because of large families who lives in a very small room and overcrowding families. So basically by avoiding this overcrowding this situation and also maintaining some few hygienes, so we can avoid these conditions. Today you have learned about chronic otitis media, what are its symptoms and who are the population at risk and what are the complications can arise from this. There can be hearing loss which can be reversible and irreversible. So I would suggest all of you to consult with your doctors to prevent this hearing loss as early as possible. So visit your doctors whenever you have these symptoms and don't be late in starting your treatment. I hope you have found this session very informative for you. So if you have any other questions besides this, you can drop comment in the comment box. So I'll be eagerly waiting for your comments. Thank you.